In Fox 5 Health News, New York State is creating a task force to stamp out hepatitis C. The virus is spread through contaminated blood, and the governor says needle sharing in the opioid epidemic has caused a rise in hep C cases. The task force will increase access to medications that can cure hep C and bolster prevention, screening, and treatment services.
All right. A new report in USA Today finds that the U.S. is the most dangerous country in the developed world to give birth.
Joining us now to talk to us about this is Fox 5's medical contributor, Dr. Devi from NYU School of Medicine. All three of us here have given birth here in the United States, so
you wouldn't think this seems so counterintuitive.
It seems shocking. I mean, we were just talking. I actually had high blood pressure. That's one of the conditions that they're talking about. So the preeclampsia during birth or during that time. I mean, what happens is, first of all, to some degree, we might have patients or mothers who are a little bit more unhealthy, perhaps, right? So maybe people who have other medical conditions, but because of our medical technology, we're able to kind of carry the baby through pregnancy and then to delivery. So maybe mothers might be a little bit older, have other conditions like diabetes, high blood pressure to begin with, or other things. But the other issue is really about the training. So some of these safety measures, this is what the article was getting towards, that there are safety measures, there are things that can be monitored during pregnancy and delivery, particularly blood loss. So during delivery, are you losing a lot of blood? And second, is your blood pressure under control, or is it getting dangerously high? Right? That can happen sometimes related to hormones and other factors. But if your blood pressure is too high, the problem is that you could have a stroke at that time, even if you're a very young person. If your blood pressure is too low, maybe related to bleeding, you can also have a type of stroke, but you can have all kinds of organ failure at that time, and then these could create lasting problems. So the issue is it necessary to go through all of this, right? And it seems that because in other developed countries, there are more protocols in place, more things to protect them, that the maternal mortality rate is coming down. So the death rate of mothers, it's safer to give birth in those places. And the U.S., with all our technology...
Yes, it sounds so bizarre.
Yeah, especially when you talk about the amount of deaths that this study looked at.
Exactly. So it's approximately 700 per year, but there's about 50,000 that they said, 50,000 women who are perhaps disabled or in danger because of these issues, and maybe more, because those are the ones that are actually recorded, right? I think what we excel at is focusing on the baby's health.
Right.
So, we actually are really good in terms of...
Obsessed with delivering healthy babies.
Exactly. Right. And babies with all kinds of dangerous medical conditions, and the mother, etc., the baby still may make it through more safely. But I think what's happened is, instead of looking at both, there's more of a focus on the baby, and sometimes the mother isn't necessarily looked at as closely. I mean, I mentioned I had it. I actually was lucky. It was caught very early, treated effectively. But I think for a lot of people out there, it's just sort of a mystery. And the important thing is, I would say in pregnancy, if you have a blood pressure cuff or if you can get one, just check these things at home. If you're anywhere over 140, over 90, or if you think you're bleeding or feeling lightheaded, better to get checked out.
That's really interesting, as you said, like especially when moms are pregnant, they always look for the best hospital for the baby, but we never think about the best hospital for the mom.
Exactly, exactly.
All right, on to our next topic. 4 vital cancer screening recommendations are being ignored. The CDC says testing rates are now well below national targets. So what's this about?
So there's screening. This is a situation where a person has no symptoms, right? But we know that because of their age, their genetics, other factors, that they're at risk for certain things. So these are pretty much cervical cancer, pap smear screening, right? Colon cancer, that's why we have colonoscopies. But basically, screening is looking at these different types of things that are preventable, right? And the target rates should be very high. It doesn't have to be 100%, but we're aiming close to that, because if you can catch these things early, you can actually intervene and save a life,
of course,
right? So you can prevent the cancer, you can prevent this problem. But what's happening is people are sort of kind of much lower than that, hovering below maybe 80% or so over these several decades, and the number continues to be going down each year. So it's concerning because these are preventable deaths or preventable cancers. The only one that seemed to go up a little bit in 2015 was colon cancer screening. So some more people are having colonoscopies, but it's just important because these are things that can be treated, and we're not talking about the folks who have symptoms. We're talking about people who feel just fine, but then go in for screening and yet are saved from a cancer.
All right, all right. Those are really pretty shoes.
Oh, I can show them right now, but thank you.
Because we were looking at a few live shots out there. It's a little messy, Nikki. Thank you, doctor.